Hey guys, my name is Victoria Matthews, and as you're aware, I'm a paramedic with Orangeburg County. You'll have to excuse my room here because, well, when I'm not at work, this is kind of what I do. Anyways, since this is an informative video, I thought I would kind of explain what I do actually as a paramedic. As a paramedic, I am the highest level of care on the ambulance. There are 3 levels currently at the national level. Well, 4 if you count an EMR, which is not on a truck. I mean, they are your emergency medical first responders, but they are not currently allowed to be on a truck as an attendant. The lowest level of care provided on an ambulance is a EMT, which is an emergency medical technician. That is your BLS provider, technically. It's what Medicare recognizes it as. Your BLS provider is certified in CPR, can do some advanced skills like put in some advanced airways. They can use tourniquets and anything that doesn't require an IV or any kind of advanced level stuff. You call 911 and you say that you're not feeling well, or hey, if you're in labor, they can deliver a baby. That's an EMT skill. Your advanced EMT, which is the step below paramedic, they can start IVs. They can treat diabetics such as hypoglycemia, which is low blood sugar. They can start IVs, and they can give D10, which brings that sugar up so that they can eat and stay at home if they don't want to go to the hospital afterwards. I mean, that's up to them. We don't kidnap patients if they don't want to go to the hospital. We treat them, which is what we're trained to do. They can give fluids, more advanced level than the EMT on the truck. Your paramedic, which is the highest level of care, has access to all the tools in the box. Your cardiac monitor, which the advanced EMT and the EMT can use that as well, but there are more specialized things such as reading EKGs and 12 leads and diagnosing fatal arrhythmias that can be detrimental to patients' health. Paramedics can interpret those and treat those just by reading that printout on the monitor. There are medications on the truck that only the paramedic can use. There are medications on the truck the EMT and the advanced can use, but as far as paramedics go, paramedics have access to everything in the back of that truck. Everything. You'll have to excuse my video, it cut off for a second, but as I was saying, as a paramedic, I am the highest level in the back of the truck, and I do have access to all the tools in the back of the truck. So if you call 911 and you are, let's say you got burned and you need pain medication for that burn, and you need to be flown to a regional burn center, I'm the one in the back of the truck that can treat that and give you the pain medication. Your advanced, your basics can treat it as well. However, they're limited in what they can provide, which is fine. All levels of care are great for the 911 system. We need all providers at all levels. As a provider, I advocate for all levels because at the end of the day, you called 911 because you need help, and at the end of the day, you're going to get that help. And just because that level may not be able to treat certain things doesn't mean that they can't get you that level of help. As a paramedic, sometimes you are staffed on the back of the truck, or you are staffed in a QRV. So if you do have those basic or advanced trucks, that paramedic in that QRV is usually chasing those trucks just to make sure that they can respond in the case that that patient needs a higher level of care than is available on that unit at the time. EMS is not a very widely talked about career. It's a very new career. It's still in the early stages as opposed to nurses and doctors and stuff like that. But we share a very similar field in what we do and how we treat patients. As a provider, the comparison to me is in the back of that truck, you call an ambulance to get somebody who is trained and specializes in a certain thing. Well, your different levels are trained in those levels. Your paramedic is similar to your doctor. We're not doctors. But we do treat patients based on the protocols that those doctors wrote for us and for us to go by. Your advanced EMT does the same thing. I mean, we, as an EMT or an advanced, they run off the same protocols and same levels. It's just they require a little bit more supervision than the paramedic does. I hope this video was a little bit more informative about what we do, and hopefully that broadened your minds a little bit to who you get when you call an ambulance.